After turning 70, most people feel the urge to get regular health checkups just to feel secure about staying healthy. But what if the very tests you believe are necessary are silently doing more harm than good, causing dehydration, hospital admissions, or even leading to unnecessary surgeries? Welcome to today's video, where we will expose 5 health screenings that may seem harmless but could actually pose more risks than benefits once you're past the age of 70. From routine colonoscopies, full body scans for peace of mind, to cardiac tests done without symptoms, many seniors are getting swept into the medical spiral simply because they continue to rely on the same tests that made sense back in their 50s. But your body has changed, and what you need now isn't just checking off a list, but making informed choices, understanding when tests are helpful, and more importantly, when to stop in order to protect your physical health, mental well-being, and financial stability. If you're on a journey to live longer, live healthier, and live with purpose, this video is for you. Let's uncover 4 tests you should consider avoiding after 70 so you don't end up paying the price with your own health and peace of mind. 1. Colonoscopy, the hidden health trap. After 70, for decades, colonoscopy has been regarded as the gold standard for screening and preventing colorectal cancer, a silent yet dangerous disease. At age 50 or 60, undergoing this procedure is widely recommended and generally provides real health benefits. But once you reach 70 and beyond, everything starts to change. A procedure that once seemed familiar and safe can now bring more risks than benefits, especially in individuals without symptoms or a clear medical history of colon issues. The issue lies in the nature of the colonoscopy itself. It's not just a routine checkup. It requires extensive preparation and is an invasive procedure, which becomes a significant burden for aging bodies. Before the colonoscopy, patients must consume large quantities of strong laxatives to thoroughly clean the intestines. This process often causes severe dehydration and electrolyte imbalances, weakening the cardiovascular and renal systems, and increasing the risk of falls, especially in older adults living alone. Furthermore, the procedure often requires sedation or anesthesia, an important factor to consider. In the elderly, the liver and kidneys function more slowly, causing sedative drugs to linger in the body longer than usual. As a result, many older patients experience confusion, dizziness, and a heightened risk of falling post-procedure, or even suffer from prolonged cognitive impairment. Unfortunately, there are numerous cases where hospitalization was needed due to complications following the colonoscopy, even though no significant colon issues were found. Another key consideration is the polyps, small growths often found during a colonoscopy. These polyps tend to grow very slowly. Most of them take 10 to 15 years to become cancerous, if at all. For someone in their 70s or 80s, the likelihood that these polyps will cause real harm within their remaining lifespan is extremely low. Yet, detecting them often prompts a chain of unnecessary procedures, biopsies, follow-up colonoscopies, even bowel surgery, leading to serious complications and skyrocketing healthcare costs, all for something that might never have become a problem. In reality, several major medical organizations and geriatric experts are now recommending against routine colonoscopies after age 70, especially if the patient has no symptoms and has had clean results from previous screenings. So what's the safer alternative? Non-invasive stool-based tests are the answer. These methods are safer, more convenient, and carry minimal risk for older adults. Tests like the FIT, fecal immunochemical test, or stool DNA tests like Cologuard can detect hidden blood or abnormalities in the stool without requiring a colonoscopy, yet still provide valuable information for colorectal cancer screening. In summary, colonoscopy after age 70 must be carefully considered. If there are no clear symptoms, undergoing this procedure may do more harm than good. At this age, a wise choice is to respect the limits of your body, avoid unnecessary interventions, and prioritize safer, gentler methods to protect your health in a sustainable and thoughtful way. 2. Full body scans, the dangerous temptation disguised as prevention. At an older age, who among us doesn't want to preserve health, detect illness early, and live long and well? It's this very mindset that makes many seniors feel reassured when they hear about full body scans. a form of comprehensive health screening using advanced machines like CT or MRI, designed to scan every corner of the body from head to toe. On the surface, it sounds persuasive and preventive, but in reality, for those over 70, full body scans can be a double-edged sword, and the sharpest edge often lies in the psychological toll. The biggest problem with full body scans is the risk of overdiagnosis. These high-tech machines not only detect dangerous abnormalities, but also pick up countless benign, harmless changes that pose no threat for the rest of a person's life. These might include a small lung nodule, a minor lesion in the kidney, or a simple liver cyst, all of them asymptomatic, non-impactful, and possibly present for decades without issue. But once the machine finds them, what happens next? Anxiety and fear creep in. The patient feels like something might be seriously wrong, which leads to a cascade of further tests, biopsies, repeated scans, surgical removals, even medication regimens, even though their body was completely fine to begin with. For younger individuals, procedures like biopsies or surgery may carry relatively low risk and quick recovery. But in older adults, they're a genuine hazard. Anesthesia, blood loss, infections, and drug-related complications can significantly affect physical and mental health, sometimes causing long-term disability or the loss of independence. And it's not just physical harm. There's a lingering psychological toll. A healthy person after a full body scan might suddenly live under the shadow of uncertainty. What if I really have something wrong? They lose sleep, feel anxious, experience prolonged stress, all while their body is actually functioning perfectly fine. This is the invisible cost many don't anticipate when stepping into the scanning room. Another important point is the financial burden. Many full-body scan services aren't covered by insurance. Older adults may spend millions of V&D, or even tens of millions, just for peace of mind, only to end up with more worry and endless follow-up appointments. So what should we do? The answer is not to reject medical technology, but to understand our bodies and listen to them wisely. After age 70, the goal isn't to uncover every abnormality, but to maintain a high quality of life, to live lightly and meaningfully. If you have no clear symptoms like unusual pain, unexplained weight loss, or changes in physiological functions, routine full-body scans are unnecessary and potentially harmful. Trust your own awareness, your daily health habits, and your ability to observe changes, rather than placing complete faith in cold, impersonal machines. Sometimes the best health decision is not doing more, but doing less, with caution and intention. 3. Cardiac stress tests, false alarms that cause real harm. Once you pass the age of 70, your heart, even if still strong, naturally undergoes changes over time. Blood vessels stiffen, blood pressure fluctuates more intensely, and EKG readings often shift in ways that don't necessarily indicate disease. Yet many older adults are still prescribed cardiac stress tests as part of routine checkups, even when they have no symptoms. This turns what was once a helpful diagnostic tool for middle-aged individuals into a risky medical trap for the elderly. A cardiac stress test evaluates how the heart functions under pressure, usually through treadmill exercise or medications that simulate physical exertion. While this can be helpful for younger people with suspected coronary artery disease, its value in those over 70 who have no symptoms is highly questionable. Why? Because age-related changes often lead to false positives, meaning the test suggests a problem where none exists. For example, a slightly irregular EKG, slower heart rate recovery, or fluctuating blood pressure might all be misinterpreted as signs of heart disease, when in fact they are normal aspects of aging. And when the results are inconclusive, doctors often feel compelled to act just in case. This can spiral into a chain of additional procedures such as coronary angiograms, stent placements, or even bypass surgeries. These interventions, often unnecessary in the absence of symptoms, carry serious risks in older adults: internal or pericardiac bleeding, kidney damage from contrast dyes, severe hypotension, infections at catheter insertion sites, even life-threatening complications. Imagine someone who's otherwise healthy, no chest pain, no shortness of breath, still taking daily walks, suddenly thrown into a medical whirlwind because of a routine test. Their physical health, independence, and emotional well-being may suffer. sometimes irreversibly. That's why more and more cardiologists and geriatric societies around the world are urging caution. Don't perform cardiac stress tests on elderly individuals without symptoms. They agree that these tests do not reduce heart attack or mortality rates in people who show no clinical signs. Instead of chasing reassurance through unnecessary tests, older adults should focus on listening to their bodies realistically. Warning signs that truly warrant medical evaluation include chest pain during exertion, unexplained fatigue, shortness of breath during light activity, prolonged or irregular heartbeats. In these cases, a stress test can be valuable. But if you eat well, sleep well, move normally, and feel generally fine, then a routine stress test might do more harm than good. In summary, after age 70, cardiac testing should not be used as a preventative measure unless there's a compelling reason. Prioritize safety, peace of mind, and quality of life. That is the wisest way to protect your heart. 4. Routine cardiac screenings without symptoms, a dangerous mistake. Repeated. For many seniors, the heart is viewed as the core of life, and the fear of heart disease often lingers silently in the background. Because of this, many older adults believe that routine heart screenings are essential to catch issues early and stay safe, even when they don't have any symptoms. However, this is a widespread misunderstanding that can easily lead to unnecessary medical interventions and even serious complications. When there are no symptoms such as chest pain, shortness of breath, prolonged palpitations, or unusual fatigue, performing routine heart tests like EKGs, echocardiograms, coronary CT scans, or stress tests can often produce misleading results. That's because age-related cardiovascular changes, like mild arterial stiffness, variations in electrical conduction, or slower recovery heart rates, can easily be misinterpreted as signs of heart disease. So what happens next? A suspicious test result can prompt the doctor to recommend a cascade of further procedures. Contrast dye coronary angiography, stent implantation, or long-term use of blood-thinning medications. And for the elderly, these interventions are far from harmless. Stent placement, although common, still carries risks like infection, bleeding, or complications at the catheter site. Blood thinners, often prescribed post-stent, can lead to gastrointestinal bleeding, internal hematomas, or even hemorrhagic stroke if misused or overdosed. Hospital stays and post-procedure recovery in older patients are typically longer and harder, often impacting quality of life and independence. What's more alarming is that large medical studies today show that routine heart testing in asymptomatic individuals does not reduce the risk of heart attacks or death, especially in older populations. In other words, early detection might not save lives, but it can definitely entangle patients in a cycle of testing, treatment, complications, and escalating healthcare costs. So what should older adults do to protect their hearts? The answer lies not in machines or tests, but in sustaining a heart-healthy lifestyle every day. Gentle, consistent physical activity, walking, yoga, tai chi, balanced diet, low in salt and sugar, rich in vegetables and whole grains, quality sleep, low stress and positive emotional well-being, maintaining social connections to stay engaged, lively, and mentally resilient. If you have no symptoms, feel well, sleep soundly, and move with ease, your body is already telling you more than any machine can. Trust that and let your doctor assess your heart only when there are clear clinical reasons to do so. In conclusion, after age 70, don't let yourself fall into the trap of testing just in case, without real medical justification. Trust your instincts, be selective with information, and prioritize your health through wise, age-appropriate decisions. Sometimes, the most powerful choice you can make is simply knowing when to say no. Saying no to repeated tests with no symptoms. Saying no to interventions that sacrifice comfort for questionable metrics. Saying no to fear-based, passive healthcare decisions. At this age, each day of joy, wellness, and independence is a priceless gift. And sometimes the greatest courage is found in pausing, doing nothing further, when it's the smartest thing to do. Final message: living wisely after 70. Choose selectively, not excessively. After turning 70, healthcare is no longer about checking every box, undergoing every test, or blindly following every medical recommendation. Instead, this is a time that demands discernment, clarity, and a deep understanding of what each medical decision truly brings to your life. Because at this stage, what matters most is not doing more, but doing what's right at the right time for the right reason. At this age, even small medical interventions come with greater risks than when you were younger. A colonoscopy, an imaging test, or a new prescription can have widespread effects on your physical health, mental well-being, and even your independence. That's why caution and knowledge are not just wise, they're essential. Let's shift our mindset. Living well does not mean living without illness. It means living with quality and dignity. Focus on the things that help you maintain clarity, mobility, independence, and peace of mind. Don't obsess over lab numbers or ambiguous imaging results. Your body speaks to you daily. If you're eating well, sleeping soundly, moving freely, and feeling content, those are the most valuable health indicators of all. Not every test is necessary. Not everything that machines detect needs treatment. And not every early detection leads to a better outcome. Remember this, saying no to a test when you feel it's unnecessary or when its risk outweigh the benefits is a form of proactive self-care. It's not neglectful, it's a sign of clarity, intention, and respect for your body's natural course. And more importantly, feel empowered to say no when needed. Say no to repeated testing when there are no symptoms. Say no to interventions that cost your comfort, freedom, or peace of mind in exchange for vague data. Say no to fear-driven, reactive healthcare decisions. At this age, each day of joyful, healthy, and independent living is a precious gift. Yon ha hang ging, and often the greatest wisdom lies in knowing when to pause, let go, and do nothing more, because nothing more is truly needed. Caring for your health after 70 is no longer about chasing every medical possibility, even ages for each after that would mean concern. That's seen, not a possibility where. It's about listening deeply, choosing wisely, and living intentionally on your own terms.